So good afternoon, everyone. We're glad you're here. We're here to talk about the American Rescue Plan grants for sexual assault survivors. This is our offering 2. I'm Peggy Helton from TASA, the grant administrator for what we lovingly call ARP-SA. And we have some other TASA folks on the meeting with us, so I just want them to take a minute to introduce themselves. So Tim, you want to go first?
Sure. My name is Tim Love. I'm the Director of Finance, Grants, and Partnerships, TASA. And so I will definitely, for folks who are involved with this grant, kind of in a administrative supporting role, helping mostly behind the scenes, and absolutely available in addition to Peggy to answer any questions you might have about the grant, where it comes from, what it's for, all of those kinds of things. So yeah, welcome. We're glad you're all here today, and we're excited about this funding source. And I will pass it off to Marissa.
Hey y'all, my name is Marissa Thomasy. I'm the grant system specialist here at TASA. On ARP-SA grant, I work on any of the tech you interact with, anytime you log in or you enter your information to something. That is something that either I work on, have worked on, sometimes have built. So if you have any tech issues, let me remind everybody to please mute your microphones. Thank you. Yeah, I can pass it off to, do we want to introduce Roger as well?
Yes.
I think he's on the call.
Roger, can you unmute and introduce yourself?
That would help, right? Hi, this is Roger Hingorani. I'm compliance auditor with TASA. I'm fairly new with TASA, but I have a lot of experience with the federal funding. So if you have any fiscal questions, anything related to fiscal auditing or fiscal monitoring, I'll be there to help you out. Thank you.
Okay. Thank you so much. So you have met, I think, all or almost all of the ARP-SA support team. So just know that you can call on us if you have any questions. So I'm going to jump right in, and I'll tell you right now that we're going to give you a lot of information, but don't feel like you have to write everything down, because there's grant materials that all of this information is going to be in, and I'm going to let you know where you can find those as well. So first, I just want to just talk about the opportunity. This is coming from the American Rescue Plan grants to support survivors of sexual assault. The federal grant actually came into the Health and Human Services Commission, and then they contracted with TASA to administer this grant, which includes subcontracting with folks to provide grant activities. So this grant opportunity is offered by TASA. It's called Grants to Rape Crisis Centers to expand mobile advocacy and partnership in underserved communities. And we are, this is our second offering on this grant. So we shortcut it to say ARP-SA offering 2. So that's what you're going to see it called in most or all the materials that you have. This is supplemental funding, which we know will end at the end of the grant project period. And for this offering right now, the end of that grant is March 31st, 2025. And we'll go through all the project period and the budget years too. If you have questions, you can put them in the chat. We'll be monitoring the chat. We want to make sure that we get all of your questions as well. So what kind of grant is this? It's a competitive grant. It has some special eligibility requirements that we're going to go through. We expect to fund 5 to 8 projects And it will be, because it's competitive, it's going to be scored by non-TASA staff. So folks who are very familiar with sexual assault services, so outside scores. There is a list of criteria that we're going to be scoring on. I'm going to go through this, but again, you don't feel like you have to write all this down because it's in the funding announcement. But we're going to be scoring on the following: the expansion into border counties where there is no or underserved communities, expansion into inland counties identified as having no service or also that are underserved, applicants that provide accompaniment to both a new hospital and a new law enforcement agency. And we're going to talk about programming a little later on and what's required and just what that means. Applicants who have planned activities that fully align with the focus area. Again, this focus area is mobile advocacy and partnerships. It's very broad. So you'll also see a list of all the activities that can be on this grant, also in the funding announcement. And just remind folks, if you're not on mute, to put your microphone on mute for us. That would be great. And applicants who are members of a SART associated with the hospital or the law enforcement that you want to provide accompaniment in, and applicants that demonstrate ability to provide culturally affirming, appropriate, and language accessible services to underserved populations. And then applicants that are able to demonstrate how the activities planned will support their accompaniment, and then this much broader mobile advocacy activities, and then applicants that demonstrate they have the capacity and financial controls to effectively administer the grant. Like I said, a lot of information, all of it's in the funding announcement and our grant materials. So who is eligible? So eligibility are sexual assault programs that meet the criteria that you see on the screen, so that meet the definition of a rape crisis center in the funding announcement. It's a pretty lengthy definition, but you can read it in the funding announcement. That meet the definition of a sexual assault program from Chapter 420 of the Texas Government Code. Those two things, the first two, pretty much align with each other. So, you know, there's not much difference between the definition of a sexual assault program if you meet that criteria to the definition of a rape crisis center in the funding announcement. Eligible organizations must meet the Texas minimum service standards, and there are links to the service standards in the application instructions. They must hold an OAG sexual assault training program certification or have applied for one and be certified within 6 months. So an organization that meets all this criteria that is not certified can go ahead and apply for certification. They can submit their certification application with their grant application. And then must include a sexual assault advocate on the grant, at least 85%. And then that advocate is the one that's conducting accompaniment as well as other services that align with the grant. And they cannot be a current ARPSA offering one grantee. I know that was a lot. Any questions on eligible organizations? So I'll move right into the project period and the grant years. So this is a little bit different. Project period is going to begin April 1st, 2023. And then, like I said, it will end March 31st, 2025, which is 24 months. Our grant years are going to be just a little different since we're starting in the middle of the federal fiscal year, which this grant does follow. The first year will be 6 months, the second year will be 24 months, and then the third year will be that last 6 months of the grant. The initial contracts will be awarded for 1 year, but when you apply, For this grant, you'll only apply once. So once you get that initial contract, if you're funded, then subsequent years funding will be distributed by an extension or some other amending process. And it will depend on, we'll tell you what that process is by the end of this year. We'll tell you what the process is next year. And you'll need to submit a work plan and a budget, but there won't be another application that has to be completed. So minimum and maximum. So year 1 and 3, where those years are for 6 months, the minimum is 40,000 a year and the maximum is 65. And then that year 2, where we have 12 full months of the grant, minimum is 80,000, maximum is 130. So some important dates to remember: the funding announcement was released on the 14th. The application is now opened it up yesterday. The final day to submit an application is March 10th. We plan to send out notice of awards March 27th, and then the grant will start on April 1st. And then how to submit: we're using Form Assembly. That is actually the link to the application. It's also in the funding announcement on our webpage. So if you go to TASA.org and you go to get involved and announcements, you'll see the whole announcement of this grant along with that link directly to the application. And we'll also see a link to all the other materials of the grant that we'll talk about in just a few minutes. So with this grant, along with filling out the application, you'll need to submit some documents. At the end of the application, there's a page that will allow all these documents. It'll tell you what format those documents need to be in. But the documents that are required is the signed resolution by your governing body that designates an authorized official. And that person who is the authorized official is one that has the authority to apply for the grant. They can accept and decline. They can cancel the grant. So they have full authority over the grant. The authorized official and the person signing the resolution cannot be the same person. So job descriptions. You'll also need to submit a job description for every staff that's on the budget. And this needs to be all in one PDF. So if you have 4 staff on the grant, you'll just put all those job descriptions together in one PDF. And all these instructions are in the application instructions. So you'll need to submit your sexual assault training program certificate from the OAG showing that you're certified, or a copy of your SATP application with proof that you submitted it. And if you submit it by email, it can just be the email where you submitted it to the OAG. And then folks would need to be certified. If they're not certified now, they have an application for certification, they need to be certified within the first 6 months of the grant. So you have 6 months to kind of work out anything with certification. Because this grant is some of the required services is accompaniment, you need one support document for each type of accompaniment you plan to provide. So one for hospital accompaniment, and that can be from a hospital representative. It does not have to be from the administrator of the hospital. It doesn't have to be the CEO. It can be someone at the hospital or a SANE nurse that can really speak to the need of the program. Same way with law enforcement, your support document has to be from a representative or staff person of the law enforcement agency. So the support document is just a letter of statement of need from that person at that entity, saying that they really need accompaniment, that an acknowledgement that there's a lack of current services, and a description of how the hospital or law enforcement agency plans to utilize this service if the organization is funded. You do not, as the organization, have to sign the support document. It's not like an MOU that you have to both sign. The support can be just from the law enforcement or the hospital entity. And then you'll need a work plan and a year one budget. And so that template is provided for you in the application. There's a link to that template where you'll pull it down. It's in Excel. Both your work plan and your year one budget are in the same Excel document. You'll fill. There's a place in the application where you can attach that and upload it to us. And one thing to be aware of on the budget, the organization names is that cell is locked. So don't be alarmed when you see it, where you won't be able to input your organization information, but we'll do that on the back end when we're reviewing it. So we want to be sure we use the legal name. There's a place for you to put your legal name or your DBA. We'll enter that organizational name on the budget for you. So kind of went through the mechanics of the grant. Let's turn now to the programming and the purpose of the grant. And am I talking too fast? Because I'm a Yankee and sometimes I get talking really fast. Are we good? Okay. All right. So the purpose of the grant is to expand mobile advocacy and partnerships in underserved communities. When you look at the full funding announcement, there's a really good definition of advocacy and partnerships, and there's quite a bit of activities that come under that heading. So we just encourage you to read the full funding announcement on what all this grant can do. There are some requirements. So anyone who is funded will have to provide either hospital accompaniment or law enforcement accompaniment. And that's accompaniment in a new hospital or a new law enforcement agency. And we consider a new hospital or law enforcement agency is one where you have not provided accompaniment services before, or where accompanying services may have been requested, but you could not provide them due to resources or lack of staff. And then other activities associated with mobile advocacy and partnership that are listed in the funding announcement. And again, these are very broad. We want to be sure folks understand kind of the full scope of activities that they can do under mobile advocacy and partnerships. And some of them are quite different than what your normal grant would allow. So we just want folks to be aware of that and to really spend some time looking at that full announcement. Priorities of the grant, you can find that on page 6 of the funding announcement under scoring. And it's all those things that I already went through earlier. So expansion into border counties, counties inland that have no service or that are underserved, provide accompaniment for hospital and law enforcement. You don't have to do both, but priority would be folks that are planning on doing hospital and law enforcement accompaniment, where where activities of focus or activities align really well with the focus area, where there's members of the SART, all those things we talked about, all of them are in the funding announcement. So you'll know where the scoring will put priorities to. Because we talked about, expanding into border counties and counties that are identified as no service, you will have access to this map that shows, you can see what is considered border counties. We're using the Health and Human Services definition of border counties, the counties that are considered underserved areas, and the counties that are considered where no services are currently available. You'll also have access to a Texas map that has all these counties with their names on it. So you'll be able to see, which counties we're talking about. So our population of focus for this grant are sexual assault survivors who are adults primarily. However, you can include services to teens or young adults. So the age group for those are 13 to 17. It's really not a grant that would be able to serve folks under 13. And then particularly services in underserved populations. And because this is the American Rescue Plan, because it came out of COVID-19 and the resources available to mitigate that, those needing assistance with safety concerns. So as you see, when you go into the funding announcement, you start looking at the activities that are allowed under this grant. You'll see some of them that are related to COVID-19. So some important definitions. Mobile advocacy means bringing advocacy services to sexual assault survivors in community, which really means meeting survivors where they are. The ability to meet survivors in safe places in their community, which, as you know, accompaniment really goes very well along those lines of mobile advocacy. And then new hospital and new law enforcement agency. We talked about this a little bit before, but it's just where you've not been able to provide services in that location before and may have been requested but couldn't be provided. So I want to talk just a little bit about reporting so that you have an idea of what you will have to report. This is not an exhaustive list, but it will give you a kind of idea. So reports, they're also completed in form assembly. You'll report quarterly. So year one will just be third and fourth quarter reports. The due dates are up there. The due dates will also are also in the funding announcement, will also be in the contracts as we when we send them out. Also have an annual report that's due October 31st. Mostly that is narrative about the impact of your program. And so because this year, it'll just be like for 6 months, that annual report. So some things we report on are demographics. So the age of clients served, the race, ethnicity, those things are, if you can capture them. We don't, they're not required, but if you can capture them, we want to know demographics. And then we do have to report a number of unique clients that receive each service within the grant year. And then the number of services provided. So number of unique clients that receive counts or advocacy, let's say, and then the number of advocate services that you provide overall. And then there's narrative questions on programming. And then the annual report is all narrative. And it's really kind of a capture on your successes, how you reached underserved populations, the impact of the funding, because some of our activities under this grant are really unique. HHSC is really interested in finding out what you were able to do with this grant that you probably wouldn't be able to do if, the flexibility or the grant wasn't there. And then we have developed some reporting tools to assist you with data collection. So there's a tool that can assist you to assign unique client IDs so that you'll be able to keep track of that, a method to track unique clients, and then a method to track the number of instances of services as well. These reporting tools are optional. You don't have to use them. We'll just make them available if you want them. So just sort of a rundown of what you can see on this announcement page. When you go to the TASA announcement page, you will find a link to the funding announcement. And that has just a wealth of information about this, this opportunity, the grant overall, mobile advocacy and partnership, what that means. I think there's about a 2-page kind of list of activities that can be included under mobile advocacy. You'll get a copy, there's a copy there, a link to a copy of the grant application questions. So you can look at the questions before you go in to fill them out. So one thing about the questions, the online application will allow you to enter information if you feel like you're going to reach more than one hospital. That's not in the application questions, but that was added. Or if you think you're going to serve more than one law enforcement agency, there's an opportunity for you to put information in about that. You're only required to do one. And we would also strongly encourage you to assess your capacity to serve multiple sites before you fill that out, but there is a spot for you to do that. There's instructions to the grant application. So you'll have that to look at before you go in and you start the application itself. There's a link to the work plan and the budget template. So you'll be able to see before you start filling it out what kind of information that you'll need to supply. There's a sample resolution. You can use it. You don't have to, but it's there for you. And then the Texas map with the priority counties labeled, and then a Texas map with the county names. So next steps. Review the funding announcement. Just encourage you to read it in its entirety. As you'll see, there's some differences in this grant. There's some flexibility that's normally not there in federal grants. We just want you to really have a good understanding of what the grant requires and what it allows, and then develop your project, and then use the link in form assembly that's posted on the TASA grant announcement page. I believe that is the only place it is posted, and that's on that grant announcement page of TASA. And then await the funding decision. We expect to send out grant notifications by March 27th. And then technical assistance. There's, if you have questions on this grant, you can send them to arp-sa@tasa.org. That goes to the support team and someone will get back to you with your questions. We can answer general questions about the grant because this is a competitive grant. We can't comment on your particular proposal. We can't do a pre-assessment of your grant proposals, and obviously can't assist in writing a grant, but we can answer questions about programming, about the grant requirements. We're here to answer those questions, so email that arpsa@tasa.org. If you need help with the sexual assault training program certification, you can contact Holly Cochran at TASA, and she has indicated that she's willing to help folks like walk through the application process. There's also on the OAG's website is their guidelines for the sexual assault training program certification. It gives you an email where you can email them for additional information if you need additional information, if you're not certified and you need to apply for certification. Okay. And questions. So
we have three,
okay.
Peggy. The first one is that the rural counties in one program service area send the survivors to one particular hospital because they're the only forensic nursing program in the area. And so just a question about how do they overcome that for the application.
So is this, okay, so rural counties in our service area send survivors to this one hospital. Okay, so is this a hospital that you have provided accompaniment before, or is this a new hospital? Because this grant is about expanding into hospitals where you have not been able to provide accompaniment before. Does that make sense?
It does, but all of the rural counties that we do not previously serve that we haven't previously served, they still send those survivors there because it's the only forensic nursing program in the area, and we already provide services there. So we want to branch out to these other rural counties, but we kind of have to overcome that because in the 7-county radius, Baylor Scott and White is the only one that's serving these survivors. There's not any other hospitals that are even considering a forensic nursing program or a SANE program at this time.
Okay. So if I'm understanding you correctly, what you're saying is this would not be considered a new hospital for you. You already provide services there, but you don't provide advocacy services in those counties that send their folks to.
Yes, ma'am.
And why, but you would like to.
Yes.
Am I understanding that correctly? Okay.
Yes.
Tim, do you want to jump in?
I'm like, why does the first question have to be such a great?
I know. So
go ahead.
A couple of things that I'm thinking. So Tim, stop me if I'm say something crazy. Okay. This grant also allows for new law enforcement accompaniment, and you have to do one of the two. So if you have a new law enforcement agency, or if an applicant has a new law enforcement agency that they want to provide accompaniment in while clients are going through their interview, that would fit under this grant as well. And then you could, like the other advocacy services that I would encourage you to look at that full announcement to see is about serving folks in community. So going out with a mobile advocacy unit, so to speak, to serve folks in community. Does that make sense? Tim, would you have anything to add?
I would just say, like, I think the timing of this grant is kind of funky because it initially came out essentially as a response to COVID. And it just, by the time it got to the state did something with it and then decided to work with us to be able to turn around and contract it out. Like, I don't want to imply that COVID is not an issue anymore. That's certainly not the case, but we're certainly in a different place with COVID. And so part of the initial intent behind it was really expanding services into places where they weren't provided before, which is part of where that requirement for it being something new, in addition to just knowing from conversations that a lot of our support team and our CEO that Rose have had with folks in the field, that there are that's a need that's not being met, and we wanted to make sure that we were funding people at a high enough level to really make an impact. So yeah, because there's also another question about that's kind of saying the same thing, like the five district area has 2 hospitals, and those are the only 2 hospitals in the game. So I think, like, looking at, again, like Peggy said, is there a law enforcement, if it's a county that the only thing they're getting is being sent somewhere else to another county because it's the only hospital that'll serve them, how can you do, if you can attach some new law enforcement accompany to that, then providing the whole services around those folks in that county where you haven't been before, as long as they fit into the mobile advocacy, all fits. So that allows you to work with that hospital, even if you like expand with that hospital, even if you're already working with it, because you at least have that new law enforcement accompaniment piece to it. So yeah, I know that some of the restrictions are hard because Texas is the experiences across Texas are so unique and so different. But one of those 2 does need to be a new, and then there's other services that you can do around
that. Answer your question.
Yes, thank you.
I see Tim put the link to the funding announcement in the chat. I also put the link to the OAG sexual assault program training certification, and the link to the certification guide, and the link to the application if folks wanted to, hit that link and mark it. Okay.
And
Let's see.
Letitia, I think, I feel like that's kind of the same answer. But let me know to Misty's question, like the response is kind of the same, but let me know if there's something more, or if that answers your question as well.
That answers it. We do have additional law enforcement that we can reach out to in those counties that don't have hospitals, that get sent to the 2 counties that do have a hospital.
So the question, I'm sorry, what does it mean under the ineligibility that child abuse is not eligible? Because the population of focus is adult survivors, and then yes, you can do youth 13 to 17. So it's not a grant that could be available for child abuse or child victims of sexual assault. Other questions that I missed?
Okay, thank you so much.
Other questions? So it says hospital and law enforcement accompaniment must be provided at new hospital agency, even if we only want to apply for mobile advocacy and partnerships, such as SART capacity building, or can we only do mobile advocacy and partnerships? So the mobile advocacy and partnerships, that one of the requirements is the hospital or law enforcement accompaniment into a new hospital or a new law enforcement. So this grant would not be one that could just be for capacity building of a SART. That can be a part of it as you're providing accompaniment, but the whole goal of this grant is to provide accompaniment into a new hospital or a new law enforcement agency. The other advocacy and partnerships is in support of that.
Okay, thank you.
Other questions? Like it went through that really fast. So it's going to process for a minute and see if you have any other questions. Have y'all had a chance to look at the announcement, I guess I would say, and the funding? Okay, good.
So Dale, yes, it at least a new hospital or a new law enforcement agency has to be a part of the project, the broader project. And I think, like we talked before, like that new means you haven't been there before. Like, if you went once 3 years ago, because you could, but haven't been able, like, like we're talking about consistency, like that you have the capacity to consistently serve that hospital or law enforcement agency with accompaniment.
Yeah, maybe they asked you one time and you just couldn't, because you didn't have enough staff or something like that. And payment to law enforcement interviews is relatively new since House Bill 1172, right? So if you haven't been able to go into those law enforcement interviews and want to start partnering with a new law enforcement agency to provide that service as well. we'll stay on for a little bit. If, folks have questions or are just thinking through questions. If not, feel free to jump off and continue your day. We certainly appreciate you being here and learning about this grant. You're interested in this grant, and we appreciate your interest as well. Let us know if any questions come up afterwards. You think, I should have asked that. That's what we're here for. Just, email us at that arp-sa@tasa.org, and we will get an answer quickly, because we understand that this is a quick turnaround for this grant. So we'll be monitoring that email address very closely in case you have questions.
And Kim, I think Kim Kim's still here. So just a reminder that it's technically a 3-year grant, but it's really 24 months. So it's a 6-month, 1 year, 6 month. The minimum for this 2 6-month segments is 40,000, and the maximum 65. And then for the year, the minimum is 80 and the maximum is 130,000. So the maximum total is basically 260,000 over those 2 years.